So last two questions. So you talk about like the public perception of new technology or the implementation of this new technology in the general public is quite hard. So how is there anything you can, is there any way you can think of that make research finding or these technology or knowledge more accessible to the public in a sense that they are more likely to adopt this technology and embrace it?
Yeah, so it's not. I don't think it's the fact that the public or not would take the technology. I think it's just the implementation from research into the public domain itself. That the issue is that the barriers basically to this are the stakeholders basically that are introducing the technology. So some of that will be governmental funding, right? Because at the end of the day, each government has a pot of money. Some amount's going to spend on healthcare, and of course, the question is that what is the biggest value for gain, right? If we invest in this much, how many patients are we going to be able to treat and maintain our population healthy? Now, the problem is, obviously, you're fighting against a losing battle because, of course, with age, of course, you're going to get more conditions that need to be basically treatable. So those are the dilemmas. So you always have this stakeholder issue itself. And I remember, I mean, even you can even break it down to like lamellar surgery and stuff. I remember chatting to a psychiatrist once, who's one of the deans here. And he said to me, Jod, maybe you could think about approaching the concept of lamellar surgery from a completely different view. And I said, like what? And he said, well, what about from an economic standpoint? And then I said, well, he goes, what's the advantage? I said, well, the advantage is, you have to do less regrafts. These grafts last longer. There's less use of medication, all this kind of stuff. I said, okay, fine. So why can't you monetize that and work out? So that's exactly what we did do. So we monetized and we worked out how much it would cost if you do a transplant, say a lamellar graft, versus basically a full thickness penetrating keratoplasty, how much it would cost the state or the governmental system itself, and over you can then do sensitivity analysis to look at this over like 5 years or 8 years or 10 years and stuff as well. Look at the difference in costing. And when you start looking at that, because these grafts last better in the longer term, it's highly basically in favor of basically doing lamellar surgery over a full thickness penetrating keratoplasty, right? Now, there's nothing, we had data on outcomes that would be in it for an ophthalmologist to read, but this kind of economic analysis is much more interesting for a policymaker or a government person to read. And, he frankly said to me, any politician is always going to be happy if you're going to say you're going to save the money, right? Nobody's going to tell you they don't want that and stuff. And of course, that's absolutely true. My agenda, of course, was always to basically push lamellar surgery, but you're pushing it through a policy making as a monetizing from an economic standpoint, which I would not necessarily think about. But people who are then in a resource management stakeholder situation, you then have to see how this would basically benefit. It's the same thing with AI. If you can basically show that by screening more people, you can reduce the morbidity of diabetic retinopathy and stuff on the individual patient and stuff, you can then actually give them in real terms, this is your cost saving by implementing this program over having 25 people sitting in a reading room, having taken photographs and then reading your thing itself, because your 25 people is going to cost you X amount of money to offer the same service delivery itself. And I think that kind of research is an important thing to do, because that's what's going to convince. You mentioned earlier about how do you convince people. So one thing is convincing your colleagues, which you can do through research, talk about your domain stuff. But the other thing is convincing stakeholders and policymakers and stuff. But they require a different level of convincing by looking at different parameters that we would not necessarily basically look at and stuff as well. But it's important because they're looking at, I have this amount of money, how am I basically going to implement that itself? With the patients, I think that, people obviously want to see new stuff, right? And people are obviously interested in understanding new technology. And I think that, you would have seen in Singapore as well, I think that generally eye ophthalmology has quite a high profile here. And I think the reason why we have that is because we try to basically showcase our stuff, whether it's on media, paper media, whether it's on social media, whether it's on the internet, whether it's through, talks, interviews, whatever, and stuff on TV and stuff. And people like to see good new stuff. They like to see, you like to, look, you can tell everyone's changing their phone every basically, 6 months or 1 year and stuff. So they like to see innovation and they like to see basically new things. And I think if they see, okay, this is what these guys are doing, this is something new happening in this area, people are quite excited about that. And you can maintain that excitement by coming up with new stuff. But it requires effort on the part of the people to be able to deliver that message so that people can take that up and understand that.
I think something that's very interesting from the Singapore perspective is that how to make the technology more accessible, but at the same time, as a doctor and also a researcher, how do you publicize in a policy-making perspective, from a patient perspective? And some term that I always think about is how to make medicine sexy in some sense. Like people are so attracted to it that, oh, we're so interested in it. So I think it's something that Hong Kong can do better in this regard. So to conclude our interview, I would also like to ask from myself perspectively, any recommendation from any young ophthalmologists and researchers, or even from med student perspective, what advice would you give them